Hi, Dr. Garima here. Shooting a video, I think lapsed 3 4 days. Tried to make it continuing, but doesn't always happen. Now, also, I kind of sneaked out. My son came from his play area and he was just having some fun, didn't want to sleep. And of course, I wanted him to sleep because then he'll get tired by the time it's 6 o'clock in the evening. So, he has this 2 point verification system like Gmail. What he does is he's like how he sleeps is he'll take my hand, okay, here. He'll put his head here. He'll wrap his one hand around my hand and he'll put his head like this and then he'll sleep. So first I have to disengage his head while removing my arm, and then I have to slightly and sneakily remove his hand. So I just remembered it's just like a 2 point verification. Because the moment he wakes up, slight movement also, he'll be like, come back, sleep next to me. I told him, you know what, you have to sleep because mama has to work. He's like, no, mama doesn't have to work. I'm like, but mama has to work. He's like, no, the work of mama is to play with you. And I'm like, that is true, but still mama has to work. So yeah, anyways, I have to leave for clinic in an hour also. So let's just start and discuss this very interesting scenario based question. This is a bit of a tricky question, okay? But you have to expect such tricky questions, and I personally like this question because it makes you think what is best for the patient, because you have options, but then you have ifs and buts also. So ultimately, you have to choose an option which satisfies the given ifs and buts of the scenario. So let's start. Each word in this question is important, okay? A 38-year-old man smoker patient, smoker, reports having been punched in the face 6 months ago during a fight, resulting in the fracturing of entire crown of his upper central incisor. He underwent root canal treatment of the left maxillary central incisor. So basically, he lost the crown of this, he underwent RCT of this. He appears motivated to improve his oral health and would prefer a fixed option. Very important keyword, fixed option. What are your fixed options to replace a tooth? It's either FPD or an implant, nothing else. He is smoking filtered roll-ups 20 a day. So see, he is a smoker, he's already smoking. He wants a fixed option. Your fixed options are FPD and implant. So immediately when you see that a patient is smoking something over 20 years and he's not ready to quit smoking and he's also having alcohol, implant is out of the window. Your implant won't have a good success rate. It won't have a good prognosis if you give in a smoker's patient, especially when anterior maxillary region is most prone to failure. Anyways, we discussed that in one of our last SBQs, right? The highest site of failure of implant is maxillary anterior. Now, plus alcohol, plus smoking onto it, very less chances of success, right? So, amongst the two options of FPD and implant is immediately out of the window. So, when I am reading these questions, all this lateral branching of my thoughts should also happen. That okay, this scenario is that I am left with this scenario only for the treatments, okay? So once you have this baseline idea going in your head, you see, whenever I'm reading a question, I'm not in a rush to see the sub questions. Many people do the mistake, they just glance to the main question and they directly jump to the sub questions because they have the options where you have to answer. Please don't do that. You take a full minute to read the question. In fact, devote another minute if you think you're confused. Because once you get a hang of the main scenario, solving SBQs will be easy. Rather than just glancing through, going on the the scenario based questions, the following questions, and then confused, oh, was this asked in the previous main scenario or not? And then repeating back and then juxtaposing everything in your head is not going to help you, and that is where you make mistakes. See, all the candidates who score less in the exam are not stupid. I believe all dentists are very smart. It's just that you're not directing your focus at the right area. if you start doing that, you all will pass. I mean, why? It's just that the competition will toughen up. You understand? That's why it's a percentile system. And they want to keep a 25% passing rate only. But at least you won't end up with like bad grades of D, 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 D. Probably you'll end up with A, B, C, acceptable. So, but don't end up with C, D, or D. Like, I don't think so. Any of my candidates have ended up with this course because they all send me their results. Most of them who have flunked were having the codes of A, C. It is very unfortunate and heart-wrenching to see that 3 clusters you score A and only in 1 cluster C. But then probably you did some kind of this mistake. But then of course in the next attempt they pretty much cleared. And all those candidates who have cleared in the first attempt have either A, or B, or B, you know, these kind of scores. Fair enough, you know. So you got the idea basically. The idea is not to ace the exam. The idea is to clear the exam by marking most of the questions right and being a level above the average thinking of other students. So, but anyways, when I'm shooting this video, it's for all, regardless you are my student or not. So even if I'm not your mentor, it's fine. Just follow this ideology, or if you find any other ideology which is better suiting for you, follow that. But do not rush through the question, okay? So yeah, let's see the scenario-based questions. No fixed prosthodontic restoration should be provided until the plaque and bleeding scores are below. This you have to mark up. So take your notebook and pen, and these are some dental key facts which you have to remember. The answer here is 10%. It's given in textbooks and it's given in my feedback. If you are solving my mocks and you click on the answer and once you submit, you'll get a nice feedback link with the explanations where it is mentioned appropriate things. So this is one of the questions where you have to mark it up. So mark it up please, it's 10%. Now clinical photographs record benefit for all of the following except. Okay. What the question is basically saying, when you take intraoral and clinical pictures, it's beneficial for all of the following reasons except one. So one answer is wrong, or not necessarily wrong. One of the answer is less desirable than the rest. Not that it's absolutely wrong. So how you solve such questions of except is you try to first see what is correct. And what is correct, you put it in one group. So what remains has to be your answer. You don't jump in to find what is wrong. You understand? So the baseline shade and color of the teeth, correct. Enable a digital smile design to simulate the replacement. True, especially for the scannings and iTeros, and you know what you do is you scan, and the photographs are really useful because then immediately you get a simulation of how it's going to look afterwards. So B option is very, very correct. To ascertain the level of supragingival plaque. It's not a wrong option actually. You know, I do take pre-op intraoral pictures from each angle in case the patient is having a lot of calculus and plaque to show him afterwards. So it does help. So I won't say it's absolutely wrong. Useful for dental-legal purpose. Of course, yes, definitely. And none. So here, if I have to choose one answer, I can either choose option E or I can choose option C. According to me, C is not wrong. But if these are the pictures given in an exam and they say that such photographs are beneficial except, then in such photographs you can actually not ascertain the level of supragingival plaque. So these pics are not that useful then. So even if you mark the answer of C or E, it should be correct according to me. And like I had mentioned, by now anybody who's studying for the part 1 exam knows that there are 40 unmarked questions. Huge number of questions. 40 is a big number, okay? So basically 10 questions in each paper is unmarked, meaning you won't get a score because 2 answers would be correct in that. Which 2 answers we don't know, but you'll come to know when you read the option, but you don't know which questions they would be, so you have to solve all of them anyways. What is the priority in the management of this case? Perfect. Now, this question is very tricky. Priority in management of this case, not the case. This case means this patient. Now, what do we know about this patient? Let's just recapitulate. He's a smoker, he's alcoholic, he has trauma history, right? But he doesn't want to quit smoking. So my overall concern for the patient would be, as his doctor, is dental and his overall well-being, because his alcohol plus smoking is going to add on to cancer. You yourself, when you are practicing as a clinician and a patient comes to you and says, I'm chewing tobacco since so and so many years, wouldn't you be concerned? Like, you will tell them, right? You have to stop tobacco, even if he must be having the most pristine dental set in the mouth. You would still tell him, right? See, tobacco causes cancer and there's great risk. You should stop it, right? So I am also giving that advice because as his doctor, I'm concerned and I feel it's my duty to inform him in case he doesn't know about it, right? So the priority in managing such patients who are consuming certain substances which are harmful in the longer run, it's your priority because it's a life risk. Cancer is a life risk, and if your advice as a doctor, because you're a doctor and you can give this advice, works, you are actually saving the life of the patient. So priority would be, let's see what are the options. Reduce caries and periodontal risk. True. Reduce erosive wear, reduce the cancer risk. Remove the stain, provide tooth restoration. A, B, A, C. See, whenever options like D and E come now, where two above options are clubbed, usually the answer is between one of them. That is why they have clubbed it. I'm not saying always, I'm saying usually. So my mind automatically goes, because I can choose two options now, right? So option A is correct, option B is correct. Option C is not my priority. It is a treatment plan, but removing the stain is not my priority. My priority is, I want to reduce the cancer risk, I want to reduce the caries and the periodontal risk, because that can actually lead to loss of something. Removing the stain is not leading to loss of anything, you understand, which is irreversible. So I'm going to go with option A and B, and that option is option D. So I'll be choosing option D, you understand? So that's a trickiness of this, but if you are properly focused with a clear mind, you can do it. Now the patient has repeated trauma. Now the question itself is saying the patient is having repeated trauma and a history of parafunctional activity. Parafunctional. What are the definitive replacement option for the missing upper right central incisor in this case? Okay. So the patient keeps on having trauma and the patient is having parafunctional activity, plus the patient is a smoker who's not ready to quit smoking. And the patient wants a fixed restoration. So like I had mentioned when I was reading the main scenario, what were my options? It was either FPD or an implant. There is no other fixed option, right? So implant was out of the window because the patient wouldn't quit smoking. My only option is a fixed partial denture. So even though this sentence of the question is long, it's pretty much a very straightforward question, Sometimes it's like a trap, just trying to lure you with many distractions, but the actual answer is pretty straightforward and easy. And sometimes the question is simple, but it's actually a mirage kind of a thing. It's a trap because the options are tricky. But this question, it's the other way around. It's pretty much straightforward. The answer is FPD. A conventional cantilever bridge using central incisor. Cantilever bridge is not a definitive long-term fixed treatment. A conventional fixed bridge, yes. A single tooth implant retained crown would have been correct if the patient was not a smoker, plus no parafunctional habit was available. So I would have chosen option C, but since I have this other ifs and buts, I'm going to choose option B. A conventional cantilever bridge is out of the question only. Cantilever bridge, first of all, is not strong, plus there is repeated history of trauma. It's going to fall off. Parafunctional habit, it's going to fall off, plus it's not a definitive long-term treatment, correct? So cantilever bridge is out of question. The single straightforward answer here is a conventional fixed bridge. Milled lithium disilicate ceramic restoration, E-Max crowns basically, are finished by This is a basic dental question. This has got nothing related to the scenario. It's a basic dental question. You, being a dentist, should know this answer. It's fire in a furnace. All the block zirconia, lithium disilicate crowns are finished by fire in a furnace. Right? The glaze comes because of that high temperature. So you know this. I'm sure anybody who's given this crowns knows this. So it's pretty much straightforward answer. So this is what the question is about. Very interesting question. Expect such tricky, trappy questions in the exam. And it actually makes you think, and such are exactly the scenarios which you encounter in your clinical practice. A thoroughly practicing clinician knows this. A freshly graduate student should know this. You will encounter sometime in your life. I know this exam becomes a little difficult for the freshly graduate students or the general dentist because some of the questions are to be answered by very skilled, long time practicing dentists who have great clinical knowledge, or specialists who, because they have studied extra 3 years of dentistry and have been exposed to various things, can answer such questions. But nevertheless, you can also easily clear this exam. Part 2 would be more easier for you for the graduate. It becomes difficult for the clinician, practicing clinician, because they have to unlearn a lot of things. A freshly passed graduate doesn't have to unlearn anything. They just have to learn some tricks and tips, how to do the technicals, and they can clear the exam. But when you go on to practice in the actual scenario, the freshly graduate dentist has a problem. The experienced clinician will not. But either ways, both of them gain and only gain. There is nothing to lose by giving this exam. You gain a very good understanding. You get to brush up on your knowledge. I love the part 1 exam, the way it's formulated. The part 2 is a different story, and I've voiced my opinions on it. But studying for part 1 exam, don't study with fear. I still get a lot of messages saying, we are scared, doctor. How am I going to study? I'm having a kid. Many things are happening in the life. I just say, stay focused. In the morning itself today, I messaged a lady. Stay focused no matter what is happening in the life. Keep sufficient time in your hand. Like, don't expect you to master the theory in a matter of a month. You should have 4 to 5 months. So in that way, whatever happening around you in your life, you falling sick, somebody else falling sick, something happening in your family, few days going without you studying is acceptable, because you have time still in your hand. You cannot stress yourself out. You have to study with enthusiasm, with pleasure, and not stress. If you study with the mindset that I should clear this exam, you will just stress out, because your focus is to clear the exam. No, your focus should not be that. Your focus should be to solve the question by choosing the right answer. When you start doing that, automatically you'll clear the exam, So it's like that. I don't know if you people have watched that movie 3 Idiots. If you have not, please do. It's an Indian movie. Very famous, very beautiful movie with a lot of ways how to live your life. And one of the sentence was, if you run behind excellence, success will follow. Don't run behind success, right? So that is my motto too in my life. And success is a byproduct of it then, So anyways, I'm always here to read your comments. They are nice. Recently, somebody left from Saudi Arabia a beautiful comment on my YouTube, like made me feel very humbled and appreciated. Very, very nice. Thank you so much for that. I'm glad the videos help you all, even though not dentistry, sometimes me just giving some unsolicited experiences of my life, my failures, my things which have been fruitful, and if they can help you in any way, great for that. So yeah, that's about it, and see you next time with another video, and have a nice day.